Thank you for joining us. Welcome to the October assignment, and our featured program is DB Peru. And we have Diana Bowie from DB Peru, who's currently in Iquitos, Peru. And Diana, if you want to say hello to everybody.
Hello.
That's great. And then we also have Catherine Hefner, the Dining for Women web guru. Catherine, if you want to say hello.
Hi.
Great. And then my name is Jada Tullis Anderson, and I'm on the program selection committee with Dining for Women. And I'm filling in for Veena, who is going on a trip to India very soon. And I'm going to go ahead and let Diana get started and tell us more about DB Peru and the program. And we want to go ahead and apologize in advance. She is in Iquitos, and although she's in the city, the web Wi-Fi connection seems to be a little bit slow. But go ahead, Diana. Thank you for joining us today.
Thank you so much. I'm so pleased to be speaking with you today. And I am in Iquitos, and it's very hot here. I thought I'd start by telling you just a little bit of the history about DB Peru. 14 years ago, I came to Peru as a tourist and quickly saw that there were some major obstacles to health care for the people living in remote areas. We particularly chose the Napo River as the area to work in because it was so isolated, and it really was considered to be one of the forgotten areas. Renzo Pena, who's a co-founder with me, and I started by delivering medicines, and then we did classes for the midwives and health workers. Over these years, we've expanded our work to 26 villages, which is about 5,000 people, but 1,000 of these, approximately 1,000, are women. One of our most important programs is our follow-up on patients with chronic problems or people that we're just worried about. About 7 or 8 years ago, we started noticing that middle-aged women were dying, and no matter what the diagnosis at death, it always started with the same symptoms in the pelvic area, bleeding and pain. So even though this wasn't formal, we felt like we had enough anecdotal information that we wanted to take some action. We actually learned that women in Peru are 4 times more likely to die of cervical cancer than those in the United States. So we began our Women's Project, and we started by doing education on women's health and aging, sexual health, family planning, and doing breast exams and pap smears. Now, these pelvic exams were a first for these women, so this was a little bit different project. Because they knew us, we got very good reception. I must comment on that. I think their trust in our other programs helped smooth the way for them to trust our programs. We learned a few things along the way, and some of them were really felt good. After our first few visits, we saw that the men were lined up outside the buildings, our classrooms, listening. So we invited them in, and it was just wonderful. They're very supportive of our programs now, and they're supportive of their wives. We also assigned volunteers to play with the children because children in Peru certainly in the jungle villages are not well disciplined. It's not that they're bad, but there's no reason to discipline them. And so when we did classes, they sort of ran wild. So when we have volunteers to play with them, it makes everything so much smoother and quieter, and then their mothers can have their exams in private. This year we're taking our project to the next level, and we're very excited about it. Dr. Jordan Shannon, who's a medical doctor from Australia, is working on her PhD in London, and she chose this project to do her thesis. Right after that, we applied for the grant for Dining for Women and got it. So we're very excited. We started our program this year with the monies from Dining for Women, and Jordan has been in Peru most of I think since February, putting our plan into action. In April, we started our formal work, and that was with 5 doctors and 5 medical students doing formal data collection in the villages, 6 villages. They collected data on demographics, general health, and women's health. Then in July, they visited these same villages again and did some really good in-depth education. We have just returned from a trip this last week where we actually were so thrilled that these women were asking us questions, and they finally got enough education to be able to ask the right questions, and so we are so pleased we are getting this information to them. For this particular educational session, no booklets existed, and so we developed our own culturally sensitive booklet with people and the way the life in the jungle looks. So we're very proud of that. This month we'll actually be starting the clinical phase of our project in October, and we'll have about 20 volunteers lined up. Not only will we be doing the screening for breast and cervical cancer, but we'll be starting to do the treatment with the cryotherapy. One of our innovative products is a self-sampling swab, which means the woman can get her specimen for HPV herself privately without a pelvic exam. Now, we will still be doing pelvic exams on the women that we can encourage to have them, but we know not every woman will want that, but we can at least test them for the HPV. And we've already gotten some real good positive feedback about this. We'll also be hopefully having the HPV vaccine available for the young girls. Our plan is to continue with this project 5 villages per year, with the goal of having the government adopting our model in the future. We're already training their workers. Again, I want to thank all the amazing women of Dining for Women for helping make this really come true for these 1,000 women in the Napo River villages. And I'm ready for questions.
That's great. Thank you so much, Diana. That was very helpful. And I enjoy learning more about it. So one of the first questions I wanted to ask you about was, you just got back from a trip on the river, and I would love it if you could kind of paint the picture for our members of what that looks like. Tell us about the boat you're in, tell us about the villages and the villagers, and what you guys are actually doing on the ground. That would be fantastic. And if you could also roll in what the Dining for Women money will be spent on. That'd be great.
Okay, great. Well, what it sort of looks like here is the Amazon River, which we go down the Amazon and up Napo. They're huge rivers. They're very fast moving, very huge, powerful bodies of water. And as you get in, Iquitos is a big port with a lot of boat traffic, but as you get into the Napo, there's actually no boat traffic. There's one boat twice a week that goes into the Napo, so it's very isolated. And so you're just traveling along the rivers very quietly. I think what you feel is it's hot and steamy. Everything is very green and lush. You see people paddling their canoes. You'll see women sitting on the side of just sitting in a canoe on the river, washing their clothes and washing their dishes. They still do that. The kids, they're so fun. I wish they could do this everywhere. But they run and they play freely without any worry about if they're going to, be taken or anything. It's really fun to see the children play. The smells are mostly like of wood fires, sort of mildewy smell. That's what in my mind. You see the huts, their houses are huts with thatched roof and on stilts because the river goes up and down. And it's really very quiet. The bugs and the insects that kind of annoy. And in every village, there's a place cleared off for a soccer field. Every village. They may not have much else, but they're going to play football. The monies that actually will be the Dining for Women monies will have been helped to these 3 trips that we've made for the solid data collection, which is so important, for the educational sessions, and then for the clinical sessions, and the equipment that is included in that, the cryotherapy, the colposcopy. And so those are more specifically the clinical products that will be used with these women, you know, the speculums and things like that.
That's great. Thank you very much. I felt like I was there. Um, can you tell us more about what some of your current challenges are?
Um, yes, there are some challenges. Probably one that we know the least about is sometimes the cultural issues, the
Mm,
traditional issues that they don't feel as comfortable maybe sharing with us, the relationships between men and women, um, their traditional ways of doing things. They're only a generation or 2 away from being very primitive. So there's sort of a mix now of Western primitive, and I think sometimes we aren't always privy to knowing exactly how those play into it, and that's not easy to get to. Even with you can only ask so many questions, but they're not going to tell you that they've gone to a shaman or something. So those issues are always at play, and we have to remember them. Um, Probably logistics and communication are probably in any remote area, but it's certainly we deal with it every day. I mean, if you don't take everything you need with you, then you've got to figure out how to do what you're going to do without it, because there's no getting in a car, there's no running to the store. You have to take everything. And communication is still difficult. It's getting better, but many times we have to send a boat ahead of time, just village to village, just letting them know we're coming to be ready for us. So those kind of issues are sometimes quite frustrating if we show up and nobody's expecting us. Uh, our biggest problem is the government policies. We work very closely with the government. We feel like that's probably the most sustainable thing we can do, because long after all the NGOs are gone, the government will still be here. But their policies of changing staff, and um, they have like annual contracts. So administrators that we work with change, they don't pass along our information, and things we put into place then aren't continued. So the government policies are very difficult.
yeah. And we have time for one more quick question. So it would be
Okay.
great if you could tell us about what the future looks like. I know you mentioned that it's transitioning to the government. The program will hopefully transition to the government. In just a few sentences, can you tell us a little bit more about what that will look like?
Well, I think in addition to that, I think we're trying to identify people within the community to take over certain programs. We're starting lives and trying to get the more experienced ones to mentor the other ones. So I think transitioning our programs to the people in the communities that we can identify would be very sustainable.
That's great. Yeah,
Thank you.
thank you very much. This has been, you know, I looked at y'all's application inside and out, and I feel like I know your website really well. But even so, this was still really educational for me, and we definitely appreciate you taking the time to talk with me and Catherine and all of the DFW members. And thank you again for that and for everything that y'all are doing in Peru. I know y'all's work is needed, and we just appreciate you acting on our behalf.
Thank you so much.
Thank you.